I'm just so excited. I don't even know what to say. Hi, everyone. It is Dr. T and I'm back. Okay, so this is what we've been waiting for. Well, at least this is what I've been waiting for. I don't know if you guys have been waiting for this, but this is what I've been waiting for. And I know that this is totally backwards, but this is what I ordered. And I ordered it from one of the medical shops here because I just definitely love the visualization of everything. I use the visualization of things for teaching. I use the visualization of things to demonstrate what we know in this physical world. I definitely use the art of visualization because I really want others to grasp what is out there and what's known and what's been put together. I'm sure it takes time to make something like this. I'm just so excited. I don't even know what to say. So as you can see, I have not opened this box at all. And my hair. Definitely, once quarantine is over, I'm going to have to refresh my hair. I'm doing my best to keep it together for these videos. But that said, I have not opened anything in this box. The only thing that I've taken is the label that actually had my physical address on it. And what let's get into it. I just want to show you what's in here. Okay, so I'm going to back up a second and I'm going to put this right here and hopefully you can see. So I am definitely one of those individuals that believes you've got to have the right tools for everything. So this is just something that I could open this up immediately and let's take a look. I am so excited. I love models. I love using models when I'm talking to my patients. I like using models when I'm talking to medical students, high school students, with residents, with fellows, with other colleagues. I think it's just brilliant. I wish I was this artistic and could actually make this on my own, but I can't. So let's open this up and see what we have in here. Again, I have not looked at it on my own, so I have no idea specifically what's in here. So this is a female pelvis that I have ordered. And it was sent actually relatively quickly. It came in less than a week. And I know things come in 2 days these days, but the fact it's still something that I think is cool. I'm like, oh my gosh, I ordered this and then it's here the following week. So let me just open it up. This is what it looks like inside of here. And you could see that this is an actual real sized pelvis, which is awesome. There's nothing better than actually demonstrating something at a point or to a point that can be as real as possible to actually get that idea across, to actually teach appropriately. Woo! I am so excited. So look at this. You have never seen anyone else get so excited about a pelvic model coming in. I love pelvic models, and you can see here, I actually have pretty large hands. That's going to be for another video. I have pretty large hands and I could actually do a lot with these hands. But that said, if you can imagine, my glove size is 6.5, 7. That's what I use when I operate. And so if you can imagine 6.5, 7, and I'm holding a pelvic model here and I can't get all the way around it, you can actually see that it is a good size pelvic model. So I'm going to open it up. There's nothing else inside of the box, so I'm going to just put that to the side. And then I'm going to have a seat here. So this is the pelvic model that I bought, and the things that come within this pelvic model, again, it's a female pelvic model, and I specifically use this type of model when teaching individuals about the pelvis, the pelvic floor, and also the bony structures, and also the soft tissue structures that are attached to the bony structures, including the spinal column here, the sacrum, some of the ligaments that are associated, as well as the muscles that are associated with this bony pelvis. So what comes also, oh, cool. There's such a cool part of this as well. When I specifically ordered this, what I wanted was something that was actually life-size, something that I can actually hold in my hands, something that I could use to demonstrate to other people what is inside of the pelvic floor, how the pelvic floor is connected, how things are organized in human beings, something really visual, something tangible, and something easily to explain. And when I take a look at this, and if you take a look here, I have the internal pelvic organs as well. And so the internal pelvic organs, and I'm going to specifically in another video go through what the components of the pelvic floor are, and also the pelvic organs. But I just think this is so cool. These are things I can take out and I can actually show. Here's a little tiny bladder, how cool. And oh, wow, you can actually see back here, hopefully I'm showing this correctly, these two represent the ureters. And so the ureters are these amazing connections between the kidney and one's bladder. There's two of them on the other side. They come in on the back side of the bladder. And again, I'll go over an entire video about what the pelvic floor structures and why I think that the human pelvis and the pelvic floor structures are cool. And it also kind of leads as to, you know, how much I love what I do and the job that I do. But I wonder if I can open this. Let's, oh, yes. And I can actually show the contents inside and how cool they've even made the representation of the inside of the bladder, you know, as close as what they can in an item that is not real, including a representation of, I don't know if you can see the lines of the muscle here. Guys, I've never been more excited about a piece in my life. You think you'd get excited over a birthday present or a handbag or something like that. I definitely get excited over anatomical structures. And take a look at this. Boom, snaps right back magnetically. I think this is awesome. So these are the two pieces that I have so far. I wonder if I can open up this uterus. Let's see. Can I open up this? Oh my goodness. Yes, I can. I can open up this uterus. You can even see some of the lining or internal aspects of the uterus, and then I can close it right on again. And of course here we've got the fallopian tubes and the broad ligament. How amazing. I don't want to say too much because there's so much to talk about and unpack in a future video, definitely. So when I'm taking a look at the rest of the, oh, there's still another portion here. And this is that last portion of our back passage. It's right over here. And that back passage, of course, is where we expel everything that our body no longer needs. And it too opens up, and how fantastically cool. They did an excellent job. This is not an advertisement. This is not sponsored. This is just me having researched something that I think would be beneficial in order to teach others, to teach students and to teach the population, and to teach students and to teach the population and to teach patients and to teach anybody who would be interested in learning about what the contents of the pelvic floor is. What is the pelvic floor? What is the pelvic floor? Why am I even concerned about the pelvic floor? Why did I go into anything that has to do with the pelvic floor? But you could see, based on how utterly cool I think this portion of the body is, why definitely I went into the profession that I did. Take a look at how cool this is. If you take a look at the spinal column here, the lower portion of the lumbar spine going into the sacrum, and you can see here the bony structures, and also as detailed as they could get in terms of the floor of the core. One of my teachers used to always say the floor of the core, essentially your pelvic floor of the core. And so your pelvic floor is essentially holding up, or is the base of that core. And one of my teachers used to say that all the time. And I'll definitely go through this model. I think this is so cool. This is well made. And the place where I actually got this from, I'll just have to open up my computer right now and then take a look as to where it was made. Let's see what I can remember. I just think that this is the coolest thing in the world. This is absolutely amazing. And I think it's just really important for individuals to understand how their bodies are put together in a way that isn't so in your face, but at the same time, in a way that is relatively easily understandable. Keep on looking down here because I want to make sure that I say where I got this medical model from correctly. So I'm just looking down and searching it on my computer, and I'm just completely happy about this. So pelvis, female pelvis. Okay, so the place where I got this model from, and again, this is a non-sponsored video, and in addition to that, this is not an advertisement. I am not representing anything about medical models. This is just something that I went online and I ordered myself, and because I just really wanted to have it in my armamentarium of teaching and have it in my armamentarium of things that I could draw back on in order to highlight points in a more poignant and real way. And so I ordered it from Medical Models, and it was relatively inexpensive. Specifically, what I ordered was the life-size anatomical human female pelvis with removable organs model. And again, you know, it's just something that I think is incredibly cool. And oh my goodness, look at this. I think that these can actually come apart. Let me just test it out. So I'm just going to take this off, dropped it, and let's see if this can actually come apart. This is one of those ligaments in the pelvic floor, and this allows you to see some of those spaces and foramens that are located within the human pelvis. And I just think this is cool. It's easily replaceable like this, and I could put it back, and it's actually hardware, so I know that I won't lose these pieces. Well, I don't know. These pieces are relatively small, and I sometimes can lose things. But that said, I think that ultimately this is so cool. I am completely delighted, and I'm looking forward to a future video where I can actually take you through this pelvic model and actually give you a little bit of insight as to what I do and how cool it is, and just something to learn about the pelvic floor and about the body, and just something, you know, people who create these things, I think, are individuals that are dedicated to the health and wealth of knowledge of the health and the wealth of knowledge of individuals like myself, like yourself. And this is cooler than I could have expected. I'm super excited about this, and I'm super excited about this, guys, and I look forward to seeing you in the future video. That's all for now. This is Dr. T, and I'll see you later.